Let's move on to our next story as we see thousands of trans people enrolled in Medicaid don't have gender-affirming care coverage. What's going on here, Genevieve?
Medicaid is a federally funded insurance program that is administered at the state level. We already know that transgender people don't have access to gender affirming care in great numbers as it is. But when we start looking at those who do have access compared to those who do not, it gets a little more fuzzy on how much equality there is within this country. The Williams Institute found out that 276,000 transgender adults are enrolled in Medicaid. That's only about 21% of the estimated 1.3 million adults who identify as trans. So we start with a number. Right around 20% of trans people have access to Medicaid. Of those who are enrolled, 60% have clear access to coverage for gender affirming care. 27% live in states where the laws either say nothing or are not clear regarding coverage for gender affirming care. And 14% live in states that actively ban coverage of gender affirming care for Medicaid. Now, this can be surgical, this can be hormone, or this can be other forms of treatment. According to the review of what is happening in the states right now in the United States, the states that ban gender affirming care from accessing Medicaid are South Carolina, Tennessee, Texas, Arizona, Nebraska, Florida, and Missouri. We are seeing other states that are moving to do this. In addition, we are seeing legislation that is being drafted in the United States House of Representatives that will do this at the federal level, and it will prohibit federal funds from being used for gender affirming care. So we're looking at any Medicare, any Medicaid, anywhere would now be limited. So we are having to really pay attention to this wider issue of insurance, of Medicaid. We have states that are trying to push Medicare and Medicaid to the point that they will stop covering adult gender affirming care so that private insurance companies will stop providing gender affirming care because Medicaid and Medicare lead the health insurance industry. Whatever Medicaid and Medicare do not cover, private insurance will soon not cover those things either.
When you're talking about Medicaid, you're talking about people who are at the bottom end of the spectrum as far as income, and they have the fewest options, and so it's
Yeah.
really irresponsible for gender affirming care to be blocked in a lot of those cases because of that fact. It's really unfair, and again, it's people in power who have access to good health care and don't ever worry about this stuff that aren't considerate of these things. It's very unfortunate.